Hello, Susie. My name's Haley Ford. I'm a speech language pathologist, and I just want to talk to you for a little bit today about your daughter, ask you some questions. It'll take like 20 minutes. If you have any questions, just let me know. But first, I just want to start off with some background information about your daughter.
All right. Well, so Stella is 3, and sweetest little thing, cute as can be. The biggest problem I think we have with her is that she does a lot of talking. She talks all the time, but nobody can really understand her. We just don't even know if she's making words. And she gets very frustrated if we don't understand what she's saying. So when she gets frustrated, she just points. So perfect example today, we were after church, went to my mother's, went to her grandparent for lunch, and she was wanting some M&Ms. And she'd been talking, and nobody pays any attention to her, and she starts getting frustrated, and she just keeps pointing, and nobody knows what she's talking about. So usually what somebody will do is say, well, show me. And so she'll walk them to wherever it is and point. So she went and took them to the M&M jar, basically just pointed at it. So we can kind of make out what she's talking about by pointing, but she gets very frustrated when we don't understand her.
Okay, so you would consider her speech hard to understand even for close family members?
Yes, I mean, her dad probably understands her better than anybody else, but even us in the family have a very hard time understanding what she's saying.
Okay, so does she often express her wants and needs verbally or more often point?
Well, she talks all the time. I'd say she's a very verbal child.
Okay.
She talks all the time, but it's usually not anything anybody can understand.
Okay. Does she respond when questions are asked or when she is asked to follow directions?
Yeah, I think she understands what we're saying. So if I say, go put your shoes on, she'll go and get her shoes.
Okay.
So she understands. She just can't communicate with us in words.
Okay. Does she answer your questions well?
Well, she can say, she'll say, yes, we can understand a little bit of yes and no, but if you're going to go anything past that, no.
Okay.
We do our best to, when you're around her all the time, you kind of figure out what she wants, but you just can't understand what her words are.
Right. Okay. So I'm going to ask you some questions about health history. Okay. Has she been hospitalized in the past 2 years?
So she was born with a cleft palate. So she had surgery at 9 months to fix that. She also had surgery, a little bit after that, she had heart surgery. And then at 2 years old, she had tubes put in her ears. So those 3 surgeries, the tubes in her ears wasn't that big a deal, but it was a surgery, they put her to sleep. So she's had those 3 things. So we follow up once a year with her heart doctor just to make sure everything's okay, but everything's been fine.
Good.
And she had a lot of ear infections before the tubes, but she's only had 1 ear infection since the tubes.
Okay. What age did her ear infection start?
Early, I don't remember exactly. Probably less than a year. So she was having them, maybe 9 months up until 2 years of age when we put tubes in.
Okay, so tubes were put in at 2 years? Okay. What was the most recent ear infection?
Well, probably about 6 months ago, she had a small infection.
But they're a lot less than
Yes,
tubes.
only 1. She's only had that 1 since in the year since her tubes.
Good. Has she been seen for a speech or hearing evaluation?
Well, she did. She was evaluated by, before she went to school, what's that called? First Steps or?
First Steps?
Yes. So she was evaluated by them.
Okay.
And they didn't see any reason for her to she didn't have any problems, so they didn't refer her to anything.
Okay, so she has never been to therapy?
Correct.
Okay. So some more developmental history. Were there any complications during your pregnancy or during the actual birth?
No, no, she was 4 weeks premature, and she spent 2 weeks in the NICU,
Okay.
but, I mean, it didn't seem to be that big a deal at the time.
What was her weight?
5 pounds.
And do you know what age she said her first word?
Let's see, she walked and said her first words about the same time, so I say she walked at a little over a year, 13 months, and her first word was at about 14 months.
Awesome. What was it?
Cat.
Cat.
We have a cat, and she loves that silly cat. Pulls on his ears and his tail, and it's very, very
Fun.
easy getting along with cats, obviously. But anyway, so cat was, she pointed and she calls it
Awesome.
cat.
Did she play patty cake or peekaboo?
Yes, she's, again, it's just, she's, I think, developmentally fine in every other way except just words. So she's good at following instructions and playing games and seems to understand what we're saying. And
Awesome.
so,
Yeah. So you have a cat. Who else lives in your household?
well, my husband, and
Okay.
she has a brother who's 1, Jared. And then my mother lives with us most of the time. My father died several years ago, and most of the time she's with me, but sometimes she lives with my sister.
Okay. So good relationship with
Oh, yeah.
family. Awesome. What is the primary language spoken in your home?
English.
Okay.
I wish I could speak another language, but never took some Spanish in college, but never
Yeah.
really learned it.
Difficult. So does anybody else in your family have any speech or hearing problems? Is there a history there?
No, let's see, my husband, I think, had some speech therapy when he was a kid. I'm trying to remember what it was for. I think it was at school. It was just for a couple of years. I don't even remember what it was for. He couldn't say his R's.
Okay.
Couldn't say his R's. So
Do you know what age that was? Like elementary school?
it was at elementary school, early elementary school, I think. But
Okay.
he got over it this
Yeah.
time.
Good.
Obviously.
I know you mentioned earlier she attended school, so is she still in school?
Well, no, she's on 3.
Oh,
No. Yeah.
so
So they evaluated her for the, like preschool type thing, I guess.
okay.
Everybody
so she's
goes.
not in preschool.
No.
Okay. Any daycare or anything?
Mhm.
Okay. Does she have any games or toys that she prefers? Any favorites that she has to play with?
Let's see. Plays with the cat a lot. Of course,
Loves
the cat
the cat.
loves the cat. Of course, the cat's always right there in the house.
Uh-huh.
She loves somebody to read to her, to hold her and read to her.
Okay.
Loves that. And she's got a couple books that she likes. Is Your Mama a Llama? She likes Is Your Mama a Llama?
It's a good one.
Yeah. And there's another book about a cat. I can't remember the
So
title of it. But
definitely loves animals.
she does like them.
Okay.
Mhm.
Awesome. Is there any other information that you can think of that is relevant to speech, language, hearing, that anything?
Well, no, it's just, I know, I hate it for her. I hate that she gets so frustrated when we can't understand her. And sometimes, she just cries and throws a fit because she can't get what she's trying to tell us.
Right. I'm sure that is frustrating.
Yeah. But I think she's developmentally, she seems fine, other than just being able to verbalize words.
Good. All right. What did you say her date of birth was?
That's a good question. August 24th, 2018.
Okay. And who were you referred by today?
I was referred by her family physician, Dr. Andrea Long.
coming in today.
Thank you.
I think that this information is very beneficial, and now we can definitely get your child the best help that she needs. We can take some next steps and talk about that